primary care internist, and I work in the East Bay in San Francisco Bay Area. I'm also a co-founder and co-director of Climate Health Now, and this is our community monthly meeting. So we're really excited you're here. One of our most treasured, respected mentors will share a lot with us. So you're in for a great hour. And I'm going to turn it to Amanda to introduce herself and share our mission.
Hi everyone. Sorry, we're trying to figure out what those red lines are. We don't know, and no one knows how to get them. Sorry about that.
Actually, I can help with that if you don't mind.
Oh.
If you go up to view options and choose annotate, you can choose the eraser function and erase the lines.
Annotate, eraser. Okay, look at that. Thank you.
Okay, thank you.
Tech support, community tech support. Thank you.
Awesome. All righty. Excellent. Well, thank you guys all for being here. I'm Amanda Milstein. I'm a primary care pediatrician. I practice in Richmond with Ashley, one of, Cynthia said she thought your daughter drew them. Surprisingly, no. And with Ashley, one of the co-founders of Climate Health Now. We are a group of California health professionals and who advocate for climate action through a health and equity framework and use community organizing to build the base of climate engaged health, allied health, and healthcare administrator professionals across California to leverage our trusted health voices in support of the climate justice movement to protect health and achieve health equity. So we have a pretty packed hour today. So we're going to do our best to keep things moving and maximize the amount of time that we get to hear from and ask questions of Linda. We'll have an opportunity for new members to say hi and introduce themselves. We have just a minute of exciting AMA news that Ashley's going to share. Then the bulk of our time will be spent learning from Dr. Rudolph, who I'll introduce in a few minutes. And then we'll give some sort of housekeeping, fundraising updates, and some save the dates. All righty, you want to go ahead, Juan?
And thank you to Schwinn, who's taking notes today. This is actually her first meeting, so thank you for doing that. And maybe Schwinn, if you want to kick us off, we'd love for anybody who if this is your first meeting with Climate Health Now, we'd love you to introduce yourself, share where you practice and live, and say hi.
Okay, there we go. Hi everyone. I'm Shuan Chang. I am a family nurse practitioner, and I live in Los Angeles, in Tarzana specifically. And actually, right now I'm working in healthcare tech.
Wonderful. Thanks for joining. Joe, do you want to say hi?
Sure. Yeah. Hi, my name's Joe Greaves. I'm the executive director of the Alameda Contra Costa Medical Association and really appreciate the invitation to attend and learn a little bit more about what your group is doing. So thanks for inviting me.
Great. Thank you. And I actually see May is here too. We'd love to have you introduce. Thanks for joining.
Oh, hi. This is May Lum, Deputy Director at the Alameda Contra Costa Medical Association. Thank you for inviting me.
And thank you guys for being here.
Yeah. I think, Bob, is this your first meeting?
I can't tell. So anyway, Bob Benjamin, basically general practice, public health. I live in Contra Costa County and am co-chair of Community Health Committee for ACCMA.
Great, glad you're here.
Committee for ACCMA.
And then I might say this wrong, but is it Manija?
Yes, yeah, this is Manny Berengi. I go by Manny if that's a little easier for everybody. Okay. So thank you so much. I'm Manny Berengi, Chief of Occupational Health at the VA Long Beach. I also do environmental medicine consultations in my spare time, and I'm very active with climate advocacy. So I'm really looking forward to learning more about you all and hopefully being able to engage more. So thank you for the invite.
Wonderful, glad you're here. And is that Mary Choi who has joined? I think you want to say hi.
Hi, yes, Mary Choi. I'm not a physician, but I work a lot with TPMG physicians doing CME. Thank you.
Great.
Thanks for being here.
Yeah. Anybody else? Your first meeting with CHN? Okay. Well, for all of those of you who've been here lots before, we're really glad you're here. And we're actually going to, if you can believe it, start with a success, which is hard to come by sometimes in the field we are all putting our hearts into. So I actually yesterday cried tears of joy, and that doesn't happen very often, but I've been working with some really amazing people in the AMA, the California kind of delegation especially, but across the country. I just happened to become a AMA member through my employer, CPMG, a couple of years ago, and got the opportunity to be a delegate. So, you know, I've been trying to learn how it all works. And along with my colleagues, Sarah Mae Smith, who's an MD PhD student at UC Irvine, and Jerry Abraham, who many people probably know, who's an amazing family medicine physician, and, you know, organized medicine leader, social justice advocate. We introduced a resolution literally 3 times over the course of 2 years, really. And this week on Monday, what we introduced was accepted as AMA policy. It was combined with a resolution from the medical students. So the AMA has acknowledged that climate change is a health crisis.
Yay.
And is aligning their lobby work around the Paris climate goals, and is working on a strategic plan to identify what the role is for physicians in the face of a climate, of a crisis like this. And then the other piece that I think is really important is that they're also kind of engaging more with how to decarbonize the healthcare sector through this resolution. So hallelujah, some success. So something really to celebrate, and especially because, as I've heard it, the AMA is, I think, the 5th largest lobby group in Washington, DC. So major lobby apparatus that now is aligning around climate action to protect health. So we have a little social media toolkit, and there's been some great press in the Washington Post. There's also one, Medical Economics. So there's a few. If you are inspired, and maybe Amanda could drop the toolkit in the chat. And if you want to, there's a sample post for Facebook or for Twitter. If you want to amplify those out, it'd be really great to celebrate the AMA getting on the right side of history. So that's something. And then I'll just start with this to share, often we kind of go to this framework in our work in community organizing to advance climate action to protect health. And in the community organizing model, we often think about the head, which is the strategy side of our work, the heart, which is why we do this work, and the values that inform what we're working on. And then those coming together in the hands, where we actually make social change in the interest of protecting everyone. And recently we've talked about kind of the narrative aspect and helping people to really feel the emotional and the values behind our work, and help inspire people to get active. But today, from Dr. Linda Rudolph, we're going to move more towards the strategy and kind of the why and the evidence behind what we're doing. So I'll turn it over to Amanda to introduce Dr. Rudolph.
Alrighty, thank you. And I just want to say this because Ashley will not say this about herself, and I only recently realized this, but the resolution that she's talking about, they wrote that resolution. It got merged with others over time, but that's something they've been working on for 2.5 years. So I just want to underscore how crazy exciting that is, and also how long these things take. Alrighty, so it is an honor to introduce Dr. Dr. Linda Rudolph, who I know many of you on this call have likely interacted with and heard speak before. Linda has a very extensive bio, so I'm going to just try to hit the highlights here. Currently, Dr. Rudolph serves as Senior Advisor on Climate, Health, and Equity for the Medical Society Consortium on Climate and Health. She previously worked as Director for the Center for Climate Change and Health at the Public Health Institute, was Deputy Director for Chronic Disease Prevention and Health Promotion in the Department of Public Health for the state, and the Health Officer for the City of Berkeley, as well as other positions. Linda was the founding chair of the California Health in All Policies Task Force. She also serves on the board nationally for Physicians for Social Responsibility, the Steering Committee for Climate Plan, and the Advisory Committee for the Bay Area Air Quality Management District. And I'm going to turn it over to you, Linda.
Thanks, Ashley and Amanda, and congratulations again on the AMA work. It's very important, so great job. I am going to talk really fast about the development of a policy action agenda on climate, health, and equity. And Amanda and Ashley asked me to basically say, where did this come from? You know, how did you develop it? And how is it being used? So next, and Amanda, I'm going to move pretty fast, so I'll just keep saying next. So the first version of this policy action agenda actually was developed in 2018 when Governor Schwarzenegger decided he was going to have in 2018, Governor Brown decided that he was going to have a global climate action summit. And we decided we should do something there on health. So the UC San Francisco Global Health Institute, Healthcare Without Harm, the Global Climate Health Alliance, and the US Climate and Health Alliance organized a global climate forum. Christiana Figueres spoke at it, which we were incredibly excited about. And then we decided we needed to do something like have a call to action at that global climate forum. So we, next. So we did that call to action, and then the World Health Organization actually picked up on it and included it in their special report to COP on health and climate change. Next. We then did basically a California version of that call to action in 2019. We got a lot of California health organizations to sign on to it. Next. And then some national organizations said, oh, we want one too. And so we did what is now the US call to action on climate, health, and equity that's been signed by many health organizations, and which is really guiding a lot of the policy work that we're doing, particularly at the Medical Society Consortium on Climate and Health. Next. So the development of this agenda took a lot of work in both talking to people that were doing advocacy work in all of the sectors that the policy action agenda touches on, which I'll talk about later, and also in really talking one-on-one with many of the health advocates and the organizations that ultimately signed on to it, because everybody had questions. Some people didn't know why we included something on incorporating meatless options in school lunches. Somebody was unclear on why we had anything about stopping extraction of oil. Somebody didn't like the language we used for X, Y, or Z. So to reach a point where we had a document that we could actually get consensus on, and that was aligned with what people outside of the health sector were prioritizing in terms of climate action, it just took a lot of talking. One-on-one, small groups, and then larger groups of what emerged as a sort of steering committee of about 8 national organizations that really worked on the final round of edits and then on getting all of the people to sign on. So I can come back in the question period if people have more questions about sort of the process, But what I wanted to do today is focused on the thinking behind it. How did we end up with this document that covers all these different policy areas, and why did we think that was important in terms of a framework for policy advocacy? So I'm going to keep referring back to this slide and go for the next one. So the first place we started with was the Bay Area Regional Health Inequities Initiative framework on reducing health inequities. And basically that shows that, you know, social inequities and institutional inequities interact to shape the places that people live, the physical, social, economic, work, services, environments in which we live, work, study, play, pray, learn. And we know that it's those living conditions that really shape health outcomes and health inequities. Next. And we call those the social determinants of health. It's how we move around, what kind of food we have access to, what our schools look like, what kind of air we breathe, what kind of water we breathe, what our working conditions are, what our social conditions are. Next. And we know that those social determinants of health, or the living conditions that shape health, are not equitably distributed across society. Some neighborhoods have lots of farmers markets and bike lanes and beautiful parks, and others do not. They're filled with cars and traffic and oil refineries and cement and fast food. Next. And that those differences in living environments create huge disparities in life expectancy. And there was just a little article about the city of Oakland that just passed a resolution declaring racism as a public health crisis, and pointing out that still today in Oakland, you know, you can tell what somebody's life expectancy is by knowing their zip code, and there's differences in life expectancy in Richmond, in Oakland, in San Francisco, all over the US of, you know, 10, 12, 15 years based on the social determinants of health. Next. So that's what that shows. Living conditions create health outcomes and health inequities. Next. And then we looked at another framework, and this is like a sort of seminal framework on climate and health. And it shows that, you know, we have these natural and human influences on the climate that create variability and change in the climate, and that lead to air pollution and crop yield changes, all the things, you know, changes in sea level, and that climate change causes adverse health impacts related to a range of different things that you're all familiar with, like heat and extreme weather and wildfire and influences on air pollution and vector-borne disease and so on. Next. And that those greenhouse gas emissions, basically, if you look at, you know, the pictures of what's causing greenhouse gas emissions, they're the same things as the pictures of what's causing adverse health outcomes in terms of the social determinants of health. It's how we get around, what kind of cars we drive, what's in our air, what food we eat, how our food is produced, what's lighting our homes, and so on. Next. You can skip this. Those lead to global climate impacts, to local climate impacts. Next. To environmental and socioeconomic impacts. Next. And to climate and health impacts, which we won't go into on this talk. Next. So that's this bottom picture. Next. So then we started thinking about, well, where's this intersection of these two different pathways? And really it comes down to what makes people vulnerable to climate change and what makes people resilient to climate change. So vulnerability is sort of the degree to which geographically, biologically, and socially, economically, people are susceptible to or unable to cope with the impacts of climate change. And resilience is kind of the flip side of that. It's the capacity of an individual or a community or an institution to effectively respond to changes in climate change while thriving and prospering and functioning. And people and communities can share characteristics of resilience or vulnerability at the same time. So together, vulnerability and resilience really refer to the intersection of resources, social connectivity, coping mechanism, exposures, access to healthcare, that determine the extent to which climate impacts health. Next. And we know that important components of that are individual health status, health and public health infrastructure, social services, our food systems, our infrastructure, and social support and cohesion. Next. And we know that because many people, especially those that live in communities that have adverse social determinants of health, suffer health inequities from climate health impacts, which Rachel Morello-Frosch from UC Berkeley and Manuel Pastor from University of Southern California dubbed the climate gap. So farm workers are likely to be more exposed to heat because they're laboring outdoors. People that already have food insecurity are more likely to be influenced when food prices go up because there's drought. People that live in already polluted neighborhoods next to refineries or busy roadways are likely to have more asthma, which makes them more susceptible to increased ozone from heat or to wildfire smoke. People that don't have access to transportation are more likely to be stuck and unable to evacuate in extreme weather, on and on. Next. And that's this intersection. Next. So in public health, we talk about the spectrum of prevention, and medical treatment is tertiary prevention, which means you're intervening after somebody is sick. Secondary prevention refers to intervening early in a disease, and primary prevention refers to doing things that prevent the disease from happening. And the things we focused on, or that we are focusing on now in the public health world, are, really trying to change the social determinants of health, to impact the conditions in which people live, work, learn, pray, play. When I was in Berkeley, we always used to say, have sex, and make those environments across the board healthier. And the best way to do that is by changing the policies and legislation that cause the shaping of those environments, which we can't do without mobilizing neighborhoods and communities. Next. So here we see it's policies and systems that are shaping living conditions and shaping the systems that are causing greenhouse gas emissions. Next. And that's why, the Lancet Commission, and this is the first Lancet Commission many years ago, said responding to climate change could be the greatest global health opportunity of the 21st century, because if we can change those policies and systems that are causing climate change, we are simultaneously changing the policies and systems that are creating living conditions that cause adverse health outcomes, or on the opposite side, promoting healthy populations. Next. And that's what we tried to do in creating the policy action agenda. we tried to look at where are the most significant overlaps in the policies and systems that are causing health inequities in our communities every day. And what are some of the most salient policy actions that we could take that would simultaneously promote healthy living conditions by changing policies and systems that create the kind of unhealthy transportation, housing, energy systems that we have now, and that would simultaneously reduce greenhouse gas emissions. Next. So the first thing that we addressed, because this was initially for a Global Climate Action Summit, was we need to basically make sure that the US is doing what it can to really make commitments to reduce greenhouse gases. And at the time, that was in the form of supporting the Paris Agreement. Next. And then we talked about what should we do to reduce reliance on the combustion of fossil fuels and transition to clean, safe, and renewable energy. I'm not going to get into the details because people can look at that online. Next. We know that the health benefits of clean energy and energy efficiency are numerous, including reducing respiratory and cardiovascular disease and adverse birth outcomes, and creating green jobs, which is important if you're thinking about the economic, social determinants of health, and reducing fuel poverty. Next. We also talked about the importance of zero emission vehicles, similarly, because they reduce air pollution, although there's new information suggesting that there's an increasing contribution from brake and tire wear to particulate matter, which is probably the worst transportation pollutant, and that we're not going to reach our goals for climate change if we only focus on reducing emissions from zero emission vehicles. Next. And so that's why I can skip that. We say really clearly that we should be emphasizing active transportation in the transition to zero carbon transportation systems, and which really means spending more money on creating an infrastructure in communities that people can use for biking, walking, wheeling, rolling, all the non-car ways that we can get around. And that won't happen unless we invest in affordable housing that has proximity to jobs and the services that people need. Next. And we know, if you look at what greenhouse gas emission reduction strategy in transportation best optimizes health, we know that the health benefits, mainly from increasing physical activity associated with reducing vehicle miles traveled, is orders of magnitude greater than the health benefits of reducing air pollution from cars. Next. We don't need to go into this, but the health benefits of active transportation are many. Next. We could if we increased bicycling and walking, and this is from Southern California, from about 4 minutes a day to 19 minutes a day for getting to and from, like the bus or the BART or whatever, we could reduce cardiovascular disease and diabetes by about 12%. Huge reduction. Next. We also know that more driving causes more motor vehicle crashes, and we know that pedestrians and bicyclists are at greatest risk. So once again, we have to link vehicle miles traveled reduction with creating the infrastructure that makes walking and bicycling not just convenient, but also safe. And we know that those pedestrian and bicyclist injuries are greatest in communities of color and low-income communities, again, because of the environments where there's more traffic and less appropriate safe infrastructure. Next. You can skip that. You can skip that. We also know that there's a lot of non-physical benefits to providing access to free public transportation. This is from a health impact assessment that Los Angeles County Health Department did on free bus transit for students in Los Angeles County, showing that families would save a huge amount of money in fines, because one of the big gateways for young youth of color into the school to prison pipeline starts when they try to evade bus fares on their way to school because their families are poor. And we also know that it would substantially decrease unexcused absences. So there's, a lot of benefits beyond the physical health benefits. Next. So we tried to look at how would you apply the call to action, the policy action agenda, to the Infrastructure Investment and Jobs Act. And Medical Society Consortium just published a brief that basically translates the call to action into a set of recommendations on the Infrastructure Investment and Jobs Act. Next. You can skip that too. When we're looking at these recommendations, and in the policy action agenda, what you see is that they get very broad quickly, because if you're thinking about reducing vehicle miles traveled, and you're talking about poor communities, you have to look at how the ramifications of policies work. You can't just plunk a bunch of bike lanes into a low-income community or put in a new transit system and not at least consider whether there's going to be ramifications on health from rising rents that push people out of their neighborhood. So that's why we incorporate the concept of anti-gentrification into thinking about how we build communities and transportation systems. Next. So again, really the point here is just that when we're thinking about climate policy, we are always thinking about what are the health and equity ramifications, and how do we optimize climate policy to also promote health and health equity at the same time. I'm just going to run through these super fast just so you get a flavor for what else is in the policy action agenda. Build local, healthy, and sustainable food and agricultural systems. I will say that this provide meat-free options in school lunches to promote reduced meat consumption is one of the, it's almost like a third rail, one of the most controversial recommendations that's in the policy action agenda. It's super important because the federal farm bill is coming up for its annual 5-year revision, and how we subsidize food production in the US has a huge impact both on healthy diets or lack thereof, and on healthy and climate-friendly agricultural systems. Next. And again, you can see the theme here. We can create more sustainably produced food, less food waste, and less meat. And then we will reduce methane emissions, reduce water pollution from pesticides and fertilizers, increase access to affordable, healthy food, and reduce obesity, cardiovascular disease, some cancers, diabetes, antibiotic resistance, and pesticide illness. These things go hand in hand. Next. The policy action agenda talks about what does it mean to build healthy, resilient communities. For example, through urban heat island mitigation by increasing green space and tree canopy in neighborhoods. Next. And again, we know that urban greening and green infrastructure are important, not just because they reduce the risk of heat illness, but also because they reduce flooding risk, they replenish groundwater. There's a lot of evidence that more green reduces crime, lowers energy costs, reduces air pollution, increases social cohesion. So the benefits of these climate solutions are many. Next. And finally, we talk about the importance of, addressing the health system, both starting by investing in climate and health. And unfortunately, in the last round of federal budget negotiations, the proposal to significantly expand funding for the Centers for Disease Control Climate and Health Program did not make it into the budget. And so that's flatlined at $10 million a year for the entire country, which is totally absurd. And there still isn't any funding for the new Office of Climate and Health Equity in the Office of the Health and Human Services Secretary. Next. So the last really important piece of the framework that we drew on for creating the policy action agenda is this piece from the Bay Area Regional Health Inequities Framework for Public Health. And that is that the systems that create adverse living conditions and that create greenhouse gas emissions, they're not God-given. They didn't just spring into being, from nowhere. We created them. And we created them through institutions like government and corporations and schools. And those institutions are shaped by our persistent social inequities and the isms that accompany them: class, race, immigration status, gender, sexual orientation. Those isms shape, redlining that still persists in the form of lack of tree canopy and increased heat risk in African American communities, or transportation systems that cut right through Black communities and severed them and basically significantly just diminished their access to jobs and resources. Next. And the only way that we can effectively tackle those systems and create policies that redress those inequities and address the climate crisis is by engaging the impacted communities in shaping the solutions, and by making sure that as we're tackling climate change, we're really optimizing the benefits. And without community support, very broad public support, we'll never gain the political and social will that will be required to make the transformational changes we need to address the climate crisis. And we won't gain political and social will unless we address the kinds of things that people are concerned about every day, which really is the social determinants of health. Next. So increasing power and voice for the historically disenfranchised communities that most often have the unhealthy living conditions that are associated with health inequities and climate vulnerability is a really important piece of implementing the policy action agenda. And it means that when we're working in the policy and systems arena, we need to also be pushing to make sure that the impacted communities that we serve as public health professionals and healthcare providers are meaningfully represented in those conversations. Next. And that's this piece, that we have to empower, collaborate, and advocate to address the social and structural inequities in how we think about reshaping and transforming the policies and systems that are driving unhealthy living conditions and the climate crisis. And if we do that through a whole spectrum of health and climate action, we will yield benefits for climate, health, and equity all simultaneously. Next. Next. So that's where Climate Health Now comes in, that we know that engaging the health sector voice in the call for climate action is really important. Next, it's important for two reasons. Oh, can skip that. It's important because people do trust health professionals and people value health. Everyone values their own health and the health of their families. And we know that when people understand that climate impacts health and that climate solutions benefit health, it engenders more support for climate solutions that are equitable and healthy. Next. So I hope that as people dig into the policy action agenda a little bit more, you will find ways to use it in your own policy and advocacy work. Next. Next. And that's it. Thank you.
Hey, if you want to come off mute and give Dr. Rudolph a round of applause, join me. Thank you, Dr. Rudolph.
Thank you, Linda.
Yeah, Linda speaks all the time in national venues, so it's really lucky to have her here. So we have actually budgeted some time, which is hard, for discussions and your questions, and we'd love to, yeah, we have about 9 or 10 minutes for questions and discussions.
And feel free to, I'm going to open us off with one question, and then feel free to either just raise your hand and come off mute, or you can also put questions in the chat. The first question, Linda, is can you just give us a brief idea of how you've seen other groups, either in the US or in the US, but in California outside of it, using the call to action in sort of real life situations?
Yeah, so there is still, there's several different and fluctuating coalitions of national organizations that work on climate policy together. ALA is really marvelous in coordinating the health community around particularly EPA actions, but also other federal actions that address air quality. And of course, many of the air quality policy relates deeply and closely to climate change. And then the consortium continues to develop stuff around climate policy, and the APHA does work that's related, and there's still a group that are developing collaborative policy recommendations. If you go to the climatehealthaction.org website, where the call to action lives, and scroll down, you will see a whole series of things that we've done recently, more recently. I'll just put one more of them in the chat. But there's a bunch. So we've done health professional sign-on letters with recommendations to the Biden administration, some of which, like, I think we made the first recommendations around establishing an Office of Climate and Health Equity in HHS. That's happened. We've done a series, one for Congress, one for Biden, on investments related to the reconciliation bill that's still maybe alive in some unknown format if Manchin ever moves. We've done a series of recommendations in coordination with Howie Frumkin and APHA that you'll also find there that are much more specific. These all build on and create more detail on the basic recommendations that are in the policy action agenda. The new infrastructure brief that the consortium just put out is also based on what's in the policy action agenda. And one of the reasons that we, and the climatehealthaction.org website is not a branded website, because it's a place we can put these recommendations that a lot of different organizations, national and regional health organizations can sign on to. So, we're debating now whether we should do one more round on reconciliation or not. But the reason that I think it's important to have organizations signed on to the policy action agenda is because it then makes it easier with each next iteration to say, but you already signed on to this. This just is the next step of detail to support this principle that you signed on to in this broad policy action. When we say, okay, now there's $1.2 trillion in infrastructure spending, and here's how we think you should spend it, we're building on those top, sort of 30,000 foot level, prioritize active transportation in the transition to low carbon transportation. And here's what it means in terms of this specific piece of legislation that just passed. Obviously, we're never going to get down in the weeds on the, 150 different transportation programs that groups like Transportation for America will. But when we decided to do an infrastructure brief, the first thing that I did was I went to the person that runs Transportation for America, and I was like, Beth, help us think through, how do we take this piece of our policy action agenda, and I sent it to her, and translate it into recommendations for the health community on the reconciliation bill. When we start working on the farm bill, I will take our policy action agenda and work with people in the, sustainable ag world and the food security world and so on, to try and translate those high-level principles in the policy action agenda into more specific recommendations relevant to some particular thing that's happening policy-wise. So somebody asked who were the 8 organizations that coalesced to drive the call to action. It was Physicians for Social Responsibility, Healthcare Without Harm, the Medical Society, the Lung Association, AAP, the American College of Physicians. That's not 8, so I'm missing somebody, but it gives you a flavor.
AMA?
No.
Okay.
APHA.
Nice.
And the National Environmental Health Association was in some of the conversations.
Any other, feel free to raise your hand or come off of mute. I think we have time for probably 1 or 2 more questions.
And Linda, if you have the infrastructure brief, I can't find a link to that, but it would be great to share that.
I think it's in the chat higher
Oh,
up.
really?
Or I'll just plug it. There it is again.
Perfect.
Okay.
Thank you.
Thank you.
Can you save the chat and send it to us? Because I'm on my phone. It's really difficult to figure it out.
Yeah, we'll share all
Thank
the
you.
links.
Thank
Yeah.
you.
Yeah. Thank you, Schwinn.
Oh, I
That was
also want to put in here an article that actually goes through the thinking and the development of this framework for anybody that's interested.
Yeah. Maybe one other question?
Hey, hi,
Yeah.
Linda. Thank you so much for the presentation. That was really wonderful. One thing that you had said when talking about the farm bill, that about the third rail, was that like mentioning red meat or limiting red meat? Was that what the third rail was?
Yes.
For a second, yeah. And that's really a shame, but I guess I can understand where that comes from.
Yeah, I had the opportunity to hear Cory Booker during the last presidential campaign. Cory Booker talking in person, and he got up and practiced, and somebody asked him a question about climate change, and he said, well, the first thing I want to say is I'm not going to take away your hamburgers. Because he's actually has some really progressive proposals on how to address agriculture, and he's vegan. And he gets these connections, but apparently he gets incredible flack at the idea that we would ask people to eat a little bit less meat. So
Diet can be close to religion.
Yeah.
Yeah.
Well, yeah. I was at a meeting with the Urgent Care Association recently, and somebody on the panel said something about reducing meat consumption, and we got some pretty negative comments about that particular issue in the feedback on our panel. So
Yeah, hard. C, did you have a question? I'm just reading your body language. No? We're good. Okay.
No. Thanks for asking.
Okay. Wonderful. Well, Linda, thank you. I always learn like 10 new things every time I hear you talk. So thank you. And we really appreciate obviously all the work that you put into this over the years, and you sharing it with us right now. So wonderful. So we have about 10 minutes left in our meeting. And we wanted to just say a thank you, because I'm sure many of you saw our emails about how last month we worked on our first ever membership fundraising drive. And we got really close. And the reason is because we want to make Climate Health Now somebody's day job, because right now it's everybody's, putting it together kind of in between the rest of our obligations. So in order to hire a staff person, our initial goal was to raise $30,000, and we got almost halfway there. So we did raise $13,615. And because Climate Health Now is a 501c3 and C4, any donations are always tax deductible. So if you didn't get a chance to join or donate, that's the QR code, but we really just want to say thank you. We had about 44 members who donated, and we really appreciate it. Yeah, exactly.
And for people who donated, we're gearing up to send something in the mail to you all. So we may be in touch to get your address if we don't have it already.
Yes.
Absolutely.
Awesome. And then I'll turn it over to Amanda for some really exciting save the dates.
Awesome. Okay, I'm going to jump around on this slide a little bit, and we will also share out these links, hopefully in a timely way. The first thing that I want to call out, because it builds on what we just heard about from Linda, is that and actually, Ashley, if you can put the links in the chat as we talk, that would be great. On Wednesday, July 27th, we're going to have what we're calling July 20th, never mind. We're going to have what we're calling part 2 of what we just learned about from Linda. So Linda will be back, as well as Naila Pope Hardin, who's the executive director of Climate Plan, and Will Barrett, who is the senior policy director for California American Lung Association, as well as Linda again, to talk about how the call to action really applies to what's going on in the California legislative and regulatory landscape right now, and really looking at ways to dive in and use it as a framework for our advocacy. So the link to, Ashley, if you can just share that link to register.
Working on it very quickly.
Okay. Okay, so then we'll just kind of go top to bottom here, the other save the date. So for CHN specific activities, as you all probably have heard from our many emails and hopefully participated in as well, we're working with an organization called Building for Mission on strategy and structure building. There's 2 important dates where we'll have an opportunity to share with all members some of the updates there. One is June 29th, which is a Wednesday, and one is July 27th. So we'll share out the registration links for those. We aren't going to have a separate July monthly meeting because we already have a lot going on in July. And then other things that we want to really uplift, and we're going to send an email later today that really focuses on what's going on with the CARB scoping plan. But as many of you guys probably know, CARB, which is the California Air Resources Board, is releasing its 2022 draft scoping plan, which, to put it bluntly, sucks. There's a lot of problems with it, and we're going to send some more information out later today, including an opportunity to sign on as individuals to 2 different letters, one that has been spearheaded by California American Lung Association and another by LA and SFA Physicians for Social Responsibility, as well as an opportunity to give public comment during next week's hearing, essentially on the draft scoping plan, and an opportunity, if you are interested and able to go to a rally outside of that meeting where they'll be hearing public comment, taking place next Thursday, the 23rd. Cindy, sorry, we will, the timing of the meetings is at 12 for the CHN meetings. Oh wait, actually I was looking at that slide. Hold on one sec. This back up. So that's related to CARB. And then we also wanted to call out, actually, why don't you talk about the CHIA fellowship?
Yeah, so CHIA is the Center for Health, Equity, Education, and Advocacy, something like that. It's out of Cambridge Health Alliance, and they have partnered with like amazing community organizers. So many of you probably know Gaura Basu, Pedja Stojacic, Marshall Gans. These are the folks behind this fellowship. And I just finished this fellowship with Jerry Abraham and Sarah Mae Smith and another CHN member, Megan Pagadala. And it was really, really valuable community organizing skills, skill building in a wonderful, across the US community. So it's actually free. You have to apply as a team. The letter of interest is due next Friday. So if you're interested in that, I'm happy to talk with you about it. We'll share the link with you so you can look at the description. It's a significant time commitment. And it's also really high yield, high value. Our final gathering just this past weekend included Marshall Gans talking, and also Arsenio Mataka, who's now in HHS, who's from California. So really valuable. And Ilana, we will share that with you. And please, anybody else, just let me know and I will follow up with you. Yeah.
And then the very last thing here, September seems far off, but it'll be here before we know it. There isn't a registration link yet, but Friday, September 23rd is the 3rd annual NorCal Symposium on Climate, Health, and Equity, and which I know many people have attended in the past and probably are making plans to do so again. But if you need to not book yourself for that day and are able to this far out, it's roughly speaking, I think like 8 a.m. to around 4 p.m. Pacific time.
Woohoo!
All righty, guys. I think we're gonna nail it on timing here.
We are, and then as always, we are wide open to any health professional or health administrator, health professional students in California. We really want like all health professionals in California to be a part of the climate movement. So if your friends want to join, they can go to our website. There's a join us button. You can take a picture of this and send it to them. But we would love to have more members join. And if anybody wants to put in the chat as we're wrapping up, anything that you think went well today, what could have gone better, we definitely are always learning. And any key learnings also would be great. Yeah, and there was a ton of save the date, so we will get those to you. And I see those who said they're interested in the CHIA fellowship, so I'll follow up with you. Oh, good. Okay. Yeah, so thank you all.
Thank you again so much for joining.
Yes. Woohoo! Awesome. I'm noting the interest on the fellowship, which is great.
So it sounds like Ilana, Cindy, and Shun. Okay,
Yep.
awesome. I like that sounds like a team. That's awesome.
Yeah. And Knox and CIC are messages too.
Oh, cool. Okay.
Great.
All righty. Bye, everybody.
Thank you. We'll be in touch. Have a great day.
Bye.
Bye.
Thanks, Linda.